few more people to come on, but we can start the meeting. I usually start them right on time at 1 o'clock. The subject of today's meeting is child abuse, and we're going to be discussing the resources and the reporting of that important issue. I know that when we had the flag raising, Mark, a couple of short weeks ago, that the numbers were like 7 out of 1,000 nationwide and 14 out of 1,000 children throughout the state of Massachusetts. Why is it so high in Massachusetts? Why is it double the national average? Is there a reason for that?
It's a great question. First of all, thank you for the invitation. Jim Ilka's online with me. Helix Human Services is proud to participate. So the numbers were, when I first did a bunch of research, was a little surprising. But in the state of Massachusetts, as I reflected, we do have, I would say, a number of mandated reporters, and we do a heavy amount of education in regarding to reporting incidents. And that could contribute to an increased number of reported incidents versus other states in across the U.S.
Do you see the numbers going higher, lower, or staying stable over the years?
I would say they've been consistent. I think that in the state of Massachusetts, we've had a high level of reporting. At Helix Human Services, we've had a consistent referral through the Department of Children and Families. I would say up until this year, which I do contribute and understand, DCF had contracted with more providers this year that had spread the number of referrals out. But from our perspective, we have kind of seen a consistent number.
What would you say constitutes child abuse?
It could be both mental and it could be also physical. So mental could be an individual using verbal communication or some sort of communication that ultimately it impacts the child in a negative way. And there can be both intentional and unintentional forms of communication that could be impacting a youth negatively. I would say the same for the physical side. Could be abuse, intentional abuse where there's physical harm, could be sexual in nature as well. But there also could be a form of abuse that could be unintentional, but yet does cause a negative impact that could become physical, if that makes sense. So in the state of Massachusetts, the Department of Children and Families has a screening unit that ultimately will determine whether a suspected abuse or neglect is investigated preliminarily, that then would trigger a deeper investigation and a support. It could lead to an identification of an individual intentionally causing abuse or neglect, or potentially even unintentionally, but has caused significant harm to a child that then leads to a support of 51B.
51B is what now, Mark?
That's a confirmation after an investigation that there has been an incident of abuse or neglect. The initial report I failed to mention would be a 51A, initial suspected abuse or neglect. But after the investigation that confirms, it would be then moved to a 51B support.
So the numbers that you were talking about, the 14 out of 1,000, 7 out of 1,000 nationwide, those are probably grossly low. a lot of this stuff goes unreported, correct?
That is correct. And those incidents with that data are confirmed cases of abuse and neglect. So they're gone through the process of an investigation, confirmed support of abuse and neglect represents those numbers. But to your point, there are a lot of incidents that involve the child that are just not reported.
So how does somebody report this? How do they go about doing it?
So the state of Massachusetts has a reporting office within the Department of Children and Families. And there is a phone number, 1-800 phone number. I don't have it in front of me, but I can get it for you. Or there's an email that could be used as a form of communication.
We have another individual from your office. Would you like to say something? Introduce yourself and
Thank you. No, I'm Jamilka. We met at the flag raising a few weeks ago. I am the Chief Relations Officer here at Helix Human Services. And not much to add. I think Mark really covered all the bases. Yeah, not much to add to Mark.
thank you so much. We have Victor Davila who just joined us. Hello, Victor, counselor.
Thank
Mark,
you, Mr. Chairman.
thank you. Another question, Mark, that I have is what resources other than yourself, and you're a tremendous resource, what other resources are available throughout the Commonwealth? We were supposed to have somebody here from the state. They'll probably come on in a few minutes. But what other resources are available through the state and local?
So locally, there's a wide variety of traditional outpatient mental health or even substance use offices. There is through the department that's insurance based. So a lot of Mass Health products would honor counseling, medication assisted treatment in the case of substance use disorder, mental health evaluations. Mass Health products are typically all honored at outpatient clinics. In the case of children that have a support of abuse and neglect, opens up a case within the state of Massachusetts that will potentially open a service plan for that child. And there are a wide variety of service contracts that DCF has that range from community-based support and stabilization services that also then may also move to a higher level of care where if a child does need to be removed from the home, there's emergency placement, foster care, there's emergency placement, residential, and then if there is a deeper level of, I would say, treatment would lead to a residential placement for all ages and across the state. And Victor, it's good to see you. We've worked together in the past a while ago.
Thank you, Mark.
It's good to see an old friend here. So thank you.
Victor, would you like to say something?
First of all, excuse me. Thank you, Mr. Chairman, for holding this meeting. This is quite an important topic in our city since we have a large number of our populations are children, and not only children but of diverse backgrounds. And one of the things that we have always struggled is to ensure that people know what resources are available in many forms of languages and where to get them. So kudos to you, Mr. Chair, and Yanilka and Mark. Thank you for doing this. Yeah.
I plan on having a tour again of your facility, Mark,
Sure.
next month if I could.
Anytime.
Because this is such an important topic. One thing I want to touch upon next month too through this committee is social media and the damage social media is doing with our youth. And there's abuse that's happening on social media. It's called bullying, and that can lead to serious mental issues and also to suicides. And we know that. And now we're seeing this crop up in the courts now in lawsuits with the parents. So I want to address that issue too, because I think they kind of like touch each other in a way. And I think that should be looked at also. Anything else to add, Mark?
No, it's an important topic that you raise. With the advances of technology, the advances of especially artificial intelligence, the advances of social media platforms, there's a greater access for children to communicate um, in a healthy way through social media. There's a lot of positive things that go along with that, but there are predators and there are a lot of dangers that exist in social media. Um, and it also includes gaming. There's a number of online gaming access for kids who want to log in and play a game, but yet there are predators pretending to be other like ages of the children with the intent of either soliciting inappropriate contact outside of the virtual world. So those dangers also exist along with the social media bullying that may exist between peers from one peer to another. It's a very easy thing to do for an individual to sit behind a keyboard or behind a phone and communicate an insult or because they're not not in front of the human, and they kind of mask or hide themselves behind the technology. So higher levels of education, especially with younger kids, um, the generations of kids and the access of technology is getting the ages are going much lower. Typically the last 10 years, you heard reports that it was kind of like 16, then it went to 12, and you now understand that there are your 8-year-olds or 6-year-olds who are accessing technology now, and they need to be educated about the dangers.
And Mark, where's the parental control here?
It's a great point. There's a lot of the social medias will do a self-report to say, are you age 14 or 16 and older? Yes or no. And the youth may be 8 and say, yes, I'm older than 16. And immediately they have access. So there is I would say no major parental controls unless the parent takes the initiative to take over the device that they may be using, whether it's a laptop or tablet or a cell phone, to put the controls on the phone.
Mark, how long has this gaming thing been going on?
I would say, even with my own kids, they range from age 16 to 22. But I would say in the last 10 years with them even, they moved from the desktop gaming systems that were isolated to online gaming through those portals. And now, you can access the online gaming from any electronic device that has Wi-Fi through a website.
Mark, how do the police interact with this too? Once there's a report, you called it a
51A. Yep,
51A and a 51B.
right.
When do the police come into this for criminal activity?
Yeah, so it's a case-by-case situation, but my understanding is the screening department investigative unit, once there is a potential criminal element, they do communicate with either local police or even the district attorney's office to ignite a higher level, especially sexual in nature or severe abuse, where a further criminal investigation would then begin.
Victor, any additional thoughts?
I just have a quick question, Mark, if you know the numbers. When it comes to the Springfield and or area, who are the age group that is most at risk of abuse?
I don't have the data in front of me. I don't have the access. I would love to research this question.
Mhm.
But I would say all youth
Yeah.
are at risk,
Mhm.
especially individuals who have, I would say, a higher level of trust of adults, or higher level of trust with other individuals where they can be lured in or
Mm,
to be taken advantage.
mm.
But I would generally say all ages are at risk, right?
Right. And Marco Yamilka, and I know this is a very broad, complex subject, but do you have any, or for the parents out there who might be listening, do you have any kind of suggestions in terms of sign or symptoms that parents should be looking at to sort of guess if the child's involved in some sort of online bullying or some sort of abuse by the peers?
Yeah, I'll start the answer, and then if Jamoka has any additional comments. But if you begin to learn about a youth and you learn about their typical behavior, a child may be bubbly, they may have an outgoing personality, and then there are signs that indicate that they become much more sullen, they become to isolate, their
Mhm.
behavioral changes may give a flag that there is something happening through social media or even interactions with the school. So generally, as that's an example. Generally, when there's a noticeable change in the behavior of the child, in will signal whether they're verbal or just through their body language, could trigger a flag that would then lead for a trusting adult, to begin to inquire about whether there is something happening in their life that is not healthy.
Okay, very well. And do you have some sort of a 1-800 number or some sort of where can parents contact you or some sort of a help number in case they do suspect or are concerned with abuse?
So the Massachusetts.gov has on their website a report child abuse or neglect page. So there is a hotline. I'm not sure if I can share this, but I'd be willing to share this if that's okay,
Yeah.
Chair. I can
Yep.
see if I can share this real quick.
Thanks, Mark.
Yeah.
We also have joining the meeting, City Council President Tracy Whitfield.
Great.
Good afternoon.
Good afternoon, Madam President.
So this is a website off of mass.gov. This is the state informational page. If it's an immediate suspected abuse and neglect, the recommendation to call 911 for a police investigation. But if it isn't immediate, and there is a suspicion of abuse or neglect, it does not have to be proven. I mean, that's an important point.
Right.
It's a suspicion that there is some sort of abuse or neglect happening with a child. There is this 1-800 hotline number. And in addition to that, there are mandated reporters that work throughout the system. So there are, for example, teachers, social workers, guidance counselors, community-based services, after-school programs, have been identified that they have interactions with a youth. They are labeled a mandated reporter, and they have the responsibility to report a suspicion of abuse and neglect to this hotline. Once that suspicion is submitted, that is labeled a 51A. And then the screening unit by the Department of Children and Families, so there's a phone, will then begin the screening process of investigating whether if there is viable information to then move it to a full investigation, where they will assign a DCF investigator who will then take charge of that case and interview all connected parties, review documentation, and then from there we'll make a determination whether it is a valid abuse or neglect case, and then it's moved to a 51B support.
Mark,
Yes.
are we short-handed statewide as far as that division is concerned? And do we rely on federal money that might be getting cut under the Trump administration?
It's a great question, Brian. I do not know that information accurate. I don't want to. I suspect, but I'm not qualified to answer that question.
Because the reason why I bring that up, you can have all the resources you want and people go there, but if you don't have the manpower to go out and do all the investigations, then it's really it's hurting the situation. So I'd like to I'll follow up on that and see where that stands. Tracy, would you like to chime in?
I'm just listening right now. So I was a DCF foster parent, so I know about these lines and 51A and the process. So I'm just listening in today, but thank you for having this important discussion.
Thank you so much. Just for clarification, what would a foster parent's role be, Tracy?
So I was a kinship foster mom. So I had my niece and 3 nephews, and we took care of them. But I just found it very difficult to deal with DCF. They tend to side with the parents a lot, and even when that's not the best method, and it's a lot of work because a parent have to bring the kids to, and it was 4 of them, so they have to bring the kids to meetings and appointments and everything you have to do with a child on top of visits with the parents and things like that. And DCF, I just think that there could be quite a bit of improvements with that system. I think reunification is important, and most people want the child to be reunified with the parent, but really gotta look at the stability of the parent in a more holistic approach than just looking at it from a reunification standpoint, because just because they're taking a certain amount of meetings or making their commitments to go to like therapy and stuff still does not all the time justify them being ready to take care of the children.
Yeah.
So that's just my personal experience. But yeah, I closed my house to that world because it's just like a lot, and you just get blamed for so much a lot of the times, and you have to prove yourself over and over again just because a child says something. And I do understand that they got to take those type of complaints seriously as well. So it's always like 2 sides to everything. Yeah, but it was just a difficult relationship. I think there could be more relationship building with the parents and the foster care parents and the DCF workers. I think they could do more unifying the whole everyone that's involved in the process together, and I don't think a lot of that happens.
We also are joined by Elizabeth Rogers from the Bay State Family Advocacy Center, and I'd like to introduce her and have her say a few words.
Hi, Tracy.
Hi, Elizabeth. We know each other.
I apologize for being a little bit late. I was actually in a meeting with Tracy till about 12:30, and I had to jump off over here. So I apologize for my lateness. So I'm from the Bay State Family Advocacy Center. We are a part of Bay State Health. but we're also the Children's Advocacy Center of Hampden County. And we partnered with Helix before. We've had some of their clients come over for services with us, and they're actually gonna be at our resource fair tomorrow. Tomorrow's our second annual resource fair. We have we have a few different components, but when there is a call to make a 51A, if some calls are transferred over to the DA's office, sometimes concurrently and sometimes separately. If there is an allegation of commercial sexual exploitation or trafficking, that will automatically go to the DA's office. And then if there's some kind of charge that might reach level of a misdemeanor or a felony, it would go there. So our agency houses the place where children have their medical exams and the forensic exam. So the forensic interviewer is someone that's trained in interviewing children. It's an investigative interview, but she's trained specifically working with children, so it's a child-friendly space. They walk into a waiting area that's child-friendly. We actually just repainted everything and have comfy chairs. So that's one component of our work. And when children come in that regard, they're considered the victim of a crime. So the parents and the child have access to our case management services there. And sometimes those referrals reach us to our therapy space also. So I'm one of the therapists there, but I'm also our VOCA grant coordinator. So part of our funding is directed through MOVA, so the Massachusetts Office of Victim Assistance, through the Victim of Crimes Act. So we get funding to work with young people if they are experience a trauma which reaches the level of crime. Those are all free services. And then through MACA, the Massachusetts Children's Alliance, we also get funding. They work with all 12 children advocacy centers across the state. And we have a grant through OVC, Office of Victim Compensation, where we work with young people that are at risk of commercial sexual exploitation or trafficking. And one of my coworkers is the Hampden County CSEC coordinator. So they work with DCF, the DA's office, the sheriff's office is appropriate. So some of our funding is for young people up to age 24. And the case management services don't necessarily have an end date, but our trauma-focused therapy, the goal is that a kid is not in trauma-focused therapy forever. You want to address what happened to them. And so it could be 3 months, 6 months, a year, 2 years. But we do evidence informed and evidence-based models for that. So we received some of the referrals from DCF, from Helix might refer one of the kids at their group homes, the Family Resource Centers of Gandara. We get referrals from anybody, the community, like we have parents that self-refer also. And then we do have another component because we are providing therapy. We also have we're a licensed outpatient mental health clinic, but we specifically only work with trauma. So if a young person has experienced a trauma, but it's not necessarily a crime, we can see them, but that's a billable service, but Mass Health will pay for that. And so we might have somebody that's lost their parent to homicide, and we can provide traumatic grief counseling for that. And we have one program. So the reason why we're not called a Children's Advocacy Center solely, we're called Family Advocacy Center, is that we also have one program that is lifespan. We have our homicide bereavement program that can work with somebody of any age if they've lost somebody to homicide. So we do work with some young people that we do also have adults. So we're the only CAC in Massachusetts that also has that lifespan program. And that also gets VOCA funding, the Victims of Crime Act funding. But you're speaking about funding in general, so VOCA itself did get cut. So VOCA, the last total award, I think was like 42 million. And this year it's 30 million. And so I think
that's a big cut.
Yeah. And so 96 agencies, 96 agencies approximately the last time there was the RFP sent out, applied for it, but now over 100 agencies applied for the smaller pool of money because, it's just harder to access ongoing funds. So I think the awardees for Massachusetts VOCA funds will find out this month, and then the culturally specific VOCA support services funds were allotted earlier this month. And the culturally specific VOCA support services are for only Western Massachusetts actually, because Mass VOCA has recognized that Western Mass just has a disproportionately smaller amount of resources, than anything by Boston, particularly in the homicide bereavement area.
Can people call you directly?
Mm-hmm. Yeah, I think I brought cards.
Okay, and you could just give that number out?
Yeah, so the main number, you can reach anybody at our FAC, it's 794-9816. So that's to do a referral. That's to talk to me if you wanna, we can do outreach. So I'm going to,
I'm gonna repeat that back.
Oh, sure.
413-794-9816.
Yep. And then, I think Yumilka you have my email. We emailed, yeah. So we emailed about our resource
Yes.
fair. Yeah. So I do a lot of outreach in Springfield, but also Hampden County, just to let people know about the different agencies. And so, part of what I do, I mean, obviously I talk about our services, but you know, there's a place in Holyoke that has trauma support services. So a family that lives in Holyoke might want something closer, you know, to home. So I try to make myself aware of what's available, because if I'm at an outreach table, if someone's from 3 towns over, you know, they happen to be there, they might not want our services, but they might just need something else that's closer to home. So I try to make myself like aware of what's in Hampden County itself.
Elizabeth, are you adequately staffed or do you need more help?
I would say we need more help. Officially, I don't know what my boss would say. She's not here. But so we have 2 openings, so we are actually actively hiring, but you know, our waiting list is immense. It's like 6 months at a minimum, and it's actually, right now, it's closed to community providers, only open to Bay State providers. Which is a challenge because we know that kids experience trauma. So yeah, if we had funds, I feel comfortable that my boss would say we would hire more therapists. But then, you know, then you come down to the space issue. So what's the space and what's the rent like? So we actually have a rotating schedule of offices that is working fairly well right now. But yeah, you know, the other part of it is too, I think that at social work schools particularly, trauma is not an easy topic to talk about like every day, all day, but that's what we do. So I think part of it is helping people to know that there's support out there. If you are doing this kind of work, because it can be, you know, it can be draining and it can be a lot. I think Tracy has a question, actually.
Tracy?
Maybe not.
No, I do. I have a question.
Okay.
Yeah, Madam President, go ahead.
Okay, thank you. So like I said, I did foster care for my niece and nephews, and they would get therapy that was not culturally competent, number one. I tried not to like spy on them. What is your department hiring for?
Oh, so we're hiring for a licensed, an LICSW, a licensed clinical social worker and a licensed psychologist.
Mm-hmm.
And so the model that we use, TFCBT, it's trauma focused cognitive behavioral therapy.
Mm-hmm.
My coworkers, not me, but my coworkers are also national trainers for that model as well. And that model has been researched with people from multiple class, multiple race. It's been implemented in countries across the world. And so that model is shown to help people of all backgrounds. It's for 3 to 18, age 3 to 18. And then within that, there's different specialties. So within that, there's a specialty for young people who've experienced commercial sexual exploitation and trafficking, young people that have experienced traumatic grief, young people living with intellectual disability, young people who've experienced racial trauma. So that within that, I've been trained in, I think 3 of the ones that I just mentioned. And then there's other subspecialties, so problem sexual behaviors and other subspecialties. So the model itself is transferable to a lot of different populations, but you know, to effectively do that model, it's important to stay up to date with all the trainings.
And is it primarily virtual? Because I just, well, I don't know. Theirs was primarily virtual, and we had them during COVID, so some of it had to be virtual. But I just found that they would not participate, and like there was like no real tools, like write this or draw this or I don't know, cognitive type of like things that can help them get their point across. You can't really do that type of thing virtually. So I just found it not effective for young kids to do like virtual therapy.
So yeah, so I think in an ideal world, and this is my personal opinion, anybody under 8 face-to-face is best. I had some 8-year-olds that are on it with virtual, so we'll use the whiteboard, you can use a virtual sandbox, you can make a virtual background, but it depends. Then you have some 12-year-olds that are not great on virtual. So it really is dependent on what the capacity of the child is, but also do they have a quiet space at home? Do they have privacy? If they have a tech issue, is someone there to help them? But I would say most of our kids come to the office in person. We are open for in person. Some of our teens like to be virtual. Some of our adults, like if they're working during the day, might see us on their lunch break. But I would say like our 2, 3, 4, 5 slots are always pretty much full in person. Yeah.
I want to throw this question out to everybody. What do we have for any public service announcements to get more of this message out to the public where they can report this? Or if they see a neighbor where something's happening in a house next door to them or something, what do we have available now and how can we expand that?
So through our training side, the training program, they have someone from DCF and I had trained the CSI team. So there was I trained about the FAC for a while, and then Nelson trained about how to make a call and like when to make a call. So they reached out to us. So I'm not 100% certain how many nonprofits know to do that to us, but that is something our agency collaborates with DCF on to do trainings about. And then I go to a ton of in the spring and summer and fall. I'm at a bunch of different outreach events, not just like West Springfield, Holyoke, Chicopee, Springfield. And so I talk about our programs, pretty directly. I don't speak on DCF necessarily though, because I'm not a DCF staff person. So I think about how to make a call and when to make a call would probably be more on like the state or DCF to fund the PSAs. I mean, we can answer questions, but whenever we do a training on it, our staff would train on our agency, the CAC process and like the aftermath of a 51A, whereas DCF trains on the actual information around the 51A call. There's online trainings too about, there's free online trainings about when to make a call too. So there is some, but I don't know if
Where do they find that?
I mean, I can write, but I don't know if like, someone wants to sit down for 2 hours and like do an online training about that, but there is availability, but I'll look that up.
Thank you so much. Victor, any closing thoughts?
Well, thank you, Mr. Chair, and thank you to you guys for doing this extremely important work. Oftentimes, our youth are kind of a silent group, and they need to be protected at all costs. So thank you so much for doing this work, which I know is very taxing, mentally draining as well. But thank you, because those youth are going to be the leaders of tomorrow. Thank you, guys. God bless you.
Thank you. Okay, thank you, Councilor Davila. Tracy, any closing thoughts? Okay, Mark, any closing?
I'm sorry, I'm on the phone. It's harder for me. It's harder for me to unmute on the phone. But I got to learn more about Helix because I don't know a lot about them. And I missed the opening statement, but I think that this is an important conversation to have, and I do think the work protecting the children is the primary goal for all of us. I just would love to see more of a holistic approach with getting everybody together and on the same page, but I really do appreciate the work that everybody's doing.
Tracy, at the beginning of the meeting, I mentioned that this committee will be touring Helix next month.
Oh, okay.
Yeah, so the whole council will be invited to that tour. And
All
I'm looking forward to that because they do tremendous work. It's so important. But it's so important to know that the parents out there have somewhere to turn if something happens. And we have a lot of resources. But we've got to make that known to the public where those resources are.
Yeah, okay. Thank you.
Thank you. And I'd like to thank everybody for attending the meeting today. And I look forward. And next month, we're going to have a special meeting on social media and the impact it's having on the young people. Thank
Can I
you.
just ask Mark one question before you go, Counselor?
Yeah.
Because I'm Chat GPT and you all right now. You said it says offer foster care programs. Is that to the families that are providing the foster care?
So we have we have a DCF contract for comprehensive foster care for youth who need a loving home.
Oh, okay.
We have a very small foster care program. I think we have only 11 or 12 youth. that we care for. It's very small, but it's more of it's a DCF contracted service for a youth that does not have a family, a guardian, or a family to live with.
Okay, but you do offer family support, mentoring, and counseling. Okay, that's great. I look forward to the tour if I'm in the
Yeah,
town.
Thanks.
just for an additional fun fact, we just celebrated our 160th year of service. We were founded in the city of Springfield in 1865, so we've been carrying the child welfare flag for a long period of time, and we continue to be committed to the children and families, not only in Springfield, for the local communities as well.
But you just said shame on you, Tracy, for not knowing us after
No,
100 years.
Feel like that. I was just trying.
They have a new name though. They were.
Yeah. I just want to say in conclusion that I want to thank everyone for attending. I want to thank Helix, the tremendous job that you do. And I want to thank Bay State Medical and Elizabeth for the tremendous job that they do. And this is to be continued, but I'm looking forward to that tour. I'd like to thank everybody and have a nice day, and the meeting's adjourned.
All right.
Thank
Thank you.
you
We'll
very
see you
much.
soon.